Hello, everyone. My name is Guillermo Perez. I'm a labor educator in the USW Department of Education and Membership Development. I'm joined here for this webinar by Joan Hill, an attorney and also a labor educator with me in Education and Membership Development. The webinar, the topic for today is the Family Medical Leave Act in the time of COVID-19. This is a follow-up webinar to a webinar we did on the Families First Coronavirus Response Act. I'm going to throw it to Joan to give folks a brief introduction to what we're going to do. Joan.
Thank you, Guillermo. What we found after the enactment of the Families First Act and the two leave provisions under that specific piece of legislation, that even though a reported 60 million workers were covered, we know that in our union, a substantial part of our membership works for employers who were not covered by those temporary leave provisions. We also know that the Department of Labor has failed us in the way they have interpreted both of these leave provisions, as well as Congress's failure regarding the exclusions of millions of workers under these acts, including our membership who works for employers of 500 or more employees. We also realize that staff and local union committees have been working to negotiate memorandums of agreement that come up with flexible leave policies that are recognizing the interest of the employees and the business interest of their employer. We also realize that there is bargaining that can take place for purposes of addressing COVID-19 issues. Many of our locals are now in the position to negotiate language related to these policies, medical leave, testing, personal protection equipment, and other effects of this public health crisis. So taking that into consideration, we decided we need to give more information to our membership about their rights and protection under standard or classic FMLA and the ability to access these benefits. In this webinar, we're going to discuss the FMLA benefits, including the continuation of health care, as well as protected leave so that your job is restored to you. We have to talk about the eligibility requirements, the medical certifications or documentation, and most specifically about what qualifies as a serious health condition as it relates to COVID-19. So as I mentioned, the different parts we're going to discuss, let's start with a discussion about benefits, Guillermo.
Okay, so we're going to briefly run through a whole series of slides here to give you just like a very bare bones explanation of the basic pieces of FMLA. And then we're going to do some Q&A to try to apply them now to the situation of COVID-19. So first of all, the Family Medical Leave Act of 1993 provides the following benefits to eligible workers, okay? Up to 12 work weeks of unpaid leave in a 12-month period. So we have to stress here that FMLA leave is unpaid leave, but consistent with the employer's and or the union contract, the employer may designate paid leave as FMLA leave, and the employer may subtract up to 12 weeks of unpaid FMLA leave for any qualifying paid leave. So for example, if you go on workers' comp or you go on short-term disability, it's quite possible that your employer will also have your FMLA time run concurrent with that. So yes, it's unpaid, but there are many situations in which you can either opt to use accruals for that time, or your employer may actually require accrual usage during that time. Now, it is again for medical leave. This would be for your own serious health condition. Family need, which is needed to care for a family member with a serious health condition. The leave may be taken continuously or intermittently or as part of a reduced schedule. During the leave, health benefits must be maintained by the employer. However, the employee is required to pay their share of the health benefits premium as if they were working. So here again, if you are paying part of the premium and you go on unpaid leave, you'll need to make arrangements to make sure that your payments continue so that you can maintain your health insurance benefit. But overall, your employer is required to maintain your benefits while you are on leave. And then when you return, you must be restored to your original position or its equivalent. Now, let's look at eligibility requirements. To qualify for FMLA leave, the worker must meet all of the following eligibility requirements. 1, you must be employed at a work site with at least 50 workers within 75 miles of the work site. You have to have worked for this employer at least 12 months, either continuously or cumulatively, prior to taking this leave, and you also must have worked at least 1,250 hours over the previous 12 months of taking the leave. Let's talk about who qualifies as family, because remember, this is leave not only for yourself, but also for a family member. So, under the FMLA, a family includes a child. Child is defined as a biological child, an adopted child, a foster child, a stepchild, a legal ward, or a child to whom the employee stands in loco parentis. This is a Latin phrase that basically means that you share a household with the child. It may not be your biological child or adoptive child, but you help pay for expenses and care for that minor child. You are acting in loco parentis, and therefore you are a family, that child's a family member to you. Let's look at, and then of course, parents. A parent means a biological mother or father, or here again, an individual who stood in loco parentis to you when you were a child. So again, it does not include in-laws, but it could, for example, include your grandmother. If your grandmother, helped raise you, you might be able to make the argument that my grandmother stood in loco parentis to me when I was a child. It also includes spouse, as recognized by state law, and this includes same-sex or common law marriages, but it does not include domestic partners, although it is possible for us to negotiate language in contracts that would include domestic partners as a family member for purposes of FMLA. Now, what does it mean what does care mean when we talk about caring for a family member? Well, it means physical care, it means psychological comfort or reassurance, it means that you're needed to transport the family member, possibly for treatment. It could mean also to arrange for long-term care. If you have an elderly parent and you need to put them in a nursing home and you need time off, for example, to make those arrangements, that would be covered. It could be for filling in for someone who regularly cares for the family member. You might have a CNA who comes in several times a week, but then a couple of days you have to fill in because that care provider can't come. And then also time off to relocate a family member to receive medical care.
Guillermo, I think it's important to note, if you go back to that slide,
Okay.
What we highlighted there, the physical, psychological, transport, and filling in situation, I think are particularly relevant to COVID-19 situations. And we have to all remember that as part of the needed to care for it, it has to be established it's medically necessary that the employee have to provide this type of care to their family member.
Okay. So now let's move on to what are qualifying conditions. Again, we've talked about the fact that everything involves this idea of having a serious health condition. Let's look specifically about, well, what are the components of that? So it starts off with the worker or the family member being cared for needs to be incapacitated, and the cause of the incapacitation would be a serious health condition. So let's look at what we mean by incapacitation. First of all, inability to work. So in the case of an employee, it means you are unable to perform any one of your essential functions as an employee. That is to say, the essential functions of your job. In the case of a family member, though, in the case, for example, a minor child, it could mean that your child's unable to attend school. Or any other family member, it could be they can't perform any regular daily activities due to a serious health condition, or treatment for a serious health condition, or a recovery from a serious health condition. Now, as applied to COVID-19 situations, a serious health condition must meet one of the following requirements. We should make clear, we're talking about here generally, not just COVID-19, but any kind of serious health condition. It starts off with you have to meet at least one of these. One, an overnight stay in a hospital, hospice, or residential medical care facility. If you have to stay overnight in that kind of a facility, that automatically qualifies as a serious health condition, even if it should turn out later that you didn't suffer from anything as all that serious. Or an incapacity for more than 3 consecutive full calendar days. So if you have a condition, a health condition that renders you incapable, for example, of doing one of your essential job functions, and you are incapacitated for more than 3 consecutive full calendar days, then that suggests you have a serious health condition. But there's more to that. Accompanied by that, you have to have 2 or more visits to a healthcare provider, with the first visit occurring within 7 days of the capacity and the second visit within 30 days. An alternative to that would be a single visit that results in a regimen of supervised treatment. And commonly that's a course of prescription medicine. So it's much more common for someone, they're incapacitated for more than 3 calendar full days. They see their doctor within the first 7 days of incapacity, and then the doctor gives them a script for their condition, and that would meet those requirements. Could be also, though, that you suffer an incapacity due to a serious chronic disorder, okay? So that's a condition that continues over an extended period of time. It requires periodic visits, at least 2 per year, for treatment by a healthcare provider, and normally causes or may cause episodes or periods of incapacity. So when we look at COVID-19, later on in the Q&A, we're going to come back to this and talk more about chronic disorders or chronic conditions. And then finally, a permanent or long-term condition for which there is no effective treatment. And with this respect, we're really looking at a kind of condition that seem like it would be chronic, but it doesn't necessarily meet the definition of a chronic condition because frankly, it's permanent and long-term, and there isn't really an effective treatment for it. So you wouldn't necessarily be going twice a year for treatment because there may not be any kind of treatment. This one's a little harder to explain, I think, Joan. I mean, how would you add anything in terms of what this is intended to cover?
Well, you know, the definition in the FMLA regulations gives examples of conditions for, again, which there are no effective treatment, such as terminal stages of a disease, Alzheimer's, those type of conditions. And I think for an employee, there may be situations related to just a general, or what we look back as classic FMLA, where the employer puts an employee on FMLA because they are on disability leave related to their long-term or permanent condition. I think it's very applicable to situations where, in regards to COVID-19, the employee is caring for the family member who has a permanent or long-term condition. The big distinction between this provision and the chronic condition is the type of care the employee or family member is receiving. The requirement under chronic is the 2 visits a year. The requirement under this section is only under supervision of a healthcare provider, although there is no active treatment. But in all of these cases, remember, we're expecting the employer to require some medical documentation to support the need for leave. for either for you or your family member.
Okay. So let's now look at notification. So if the leave is foreseeable, 30 days or more in the future, the worker must give at least 30 days advance notice. However, if a 30-day notice can't be given, notice must be as soon as practicable or possible, meaning the same day or the next business day of when the employee learns of the need for leave, but taking into account all the facts and circumstances. Okay, so I know that was a lot of information in a very short period of time, but you know, our hope is that folks already are somewhat familiar with the FMLA, and we will be producing more webinars for folks who aren't very familiar with it to get, you know, more of a thorough understanding of it. But for the purposes of our webinar today, we want to focus on some issues that we've seen come up around COVID-19. So let's start off with this first question. If I or a family member is diagnosed with COVID-19, will that automatically qualify me for FMLA leave? Now, Joan, I know a lot of people are thinking like, I mean, this is a deadly disease, right? It's 10 times more deadly than the common flu. So wouldn't you just automatically assume that this is a serious health condition? So what's the answer to that question?
Well, the answer is going to be no, and for two reasons. And my analysis goes back to the FMLA regulation that says flu is not covered unless there are complications. And when there are complications, it takes the flu out of the box that says it's not covered and can put it into a box that meets the definition of serious health condition. So that tells us you must still meet the definition or the criteria established to qualify as a serious health condition. The overnight stay in the hospital, the continuing treatment, which is the incapacity plus treatment. You know, part of this is going to require a visit to a healthcare provider.
Yeah, let's look at that. This was the slide we discussed previously on this, right? So
yes.
The whole 2 or more visits and all of that, right?
Right, and when we think about the visit for purposes of qualifying, the visits language requires the contact with the healthcare provider be in person.
Oh, you're getting ahead of us. You're getting ahead of us here, Joan. Don't give it away, man.
Well, I mean, I think part of this has to address the need to visit the healthcare provider with the regimen of treatment. So when we talk about the visits, the qualifying conditions, it still has to be certified or documented by the healthcare provider. I don't think employers are going to apply the automatic rule, but still require some documentation.
Right, and we know with COVID-19, at least for now, there is no, you know, there is no effective treatment. There's no, so it wouldn't be at all unusual for someone's doctor to say, there's no prescription for me to give to you other than, you know, stay home.
Right, and the section there that says 2 or more visits, I mean, we can anticipate that if you've been diagnosed, that may have been the result of testing. The first visit can be your first test where you are diagnosed positive, and then subsequent visits can be the result of retesting to determine if you are negative. And the CDC is going to recommend 2 negative tests to essentially determine that you have recovered from COVID-19.
Right. And CDC, we mean the Centers for Disease Control and Prevention, the federal agency that's putting out a lot of recommendations, right, for how people are supposed to deal with this pandemic. Let's look at the next question, because Joan's already sort of touched on this. Does my visit to a healthcare provider have to be in person as far as establishing that I or a family member has COVID-19 for purposes of qualifying for FMLA leave? Can the visit be via telephone or video chat? So we're seeing in a lot of situations, right, Joan, we're seeing healthcare providers telling people, you know, don't come to my office, don't come here or what have you, because, if you have this, that could complicate things for us. So in a lot of cases, we're seeing people getting their visit via a video chat or by telephone, right?
Right, and what we saw in the Families First Act as well was to put some obligations, some requirements on health plans to cover treatment, testing for COVID-19, as well as anticipating that testing and treatment may be the result of telephone or telemedicine, and that plans should be covering that service under the health plan. So even though we know the first visit under the regulation requires in person, we have to look to the guidance under the Department of Labor with Families First, as well as information related to health plans and benefits to make the link between a visit and telemedicine as an appropriate way for treatment and visits. People are not visiting doctors, they're staying at home as part of their treatment, but we also have to expect that if the health plan is required to cover these televisits, that this should be acceptable.
And then there's the documentation is still a part of it. You're still going to have to document this in some way, right?
Correct. And again, all of these qualifying conditions, we presume that they're under advice of a healthcare provider.
Okay, let's look at question number 3. What will I need to provide to return to work if my COVID-19 related absence is covered by FMLA? So we didn't really get into very much about, return to work under standard FMLA. So what do you think, Joan?
Well, there is language. It's covered under the regulations that speak to return to work. Your employer may require documentation from the healthcare provider that releases you to return to work. As we indicated in the first question, that sometimes your documentation of the serious health condition may be as simple as a doctor's note. Mm-hmm. And can that doctor's note also support the return to work from your healthcare provider? We recognize that in some cases an employee may receive short-term disability as a result of their COVID-19 diagnosis and treatment being staying at home. And the employer, in many situations, when an individual is returning from short-term disability, requires the employee to clear through the company doctor or clinic. So we, again, applying classic FMLA to the COVID situation, documentation may be required.
All right, let's look at question 4. If my healthcare provider orders me to self-isolate for 14 days because I've been exposed to the coronavirus, would that qualify me for FMLA leave? So, and we're seeing a lot of this, right? We're seeing folks being told, if you've been exposed, you need to self-isolate. The issue now is going to be, is my employer going to give me FMLA leave to do that? So what do you think, John?
Well, again, we're not going to say it's automatic. The documentation will have to be supporting the need for leave, but I think this is going to be one of those yes answers, to the extent that if you have a reason to believe you've been exposed, you have this conversation with a healthcare provider. Treatment includes an examination or evaluation by a healthcare provider to determine if you have a serious health condition, the absence to be tested, as well as self-isolating would substantiate the criteria or meet the criteria for FMLA qualifying condition. Again, we refer to the Centers for Disease Control and their guidelines. This has been a very helpful resource to us. And I assume employers are using the same information. If you've been tested positive, this is what the healthcare provider is directed to do. Tell you to self-isolate, and ultimately, some point in the future, will test you at least once, most likely twice, to confirm a negative outcome.
The issue of testing, I mean, this has been a big story around this pandemic, the lack or the unavailability of testing. And I'm going to refer back to the slide that we looked at. Incapacitation due to a serious health condition, or treatment for a serious health condition, or recovery from a serious health condition. Part of treatment means getting a diagnosis, right? So if you're showing symptoms, the fact that you don't have a test available to you, or if your healthcare provider is saying, in the absence of testing, I'm telling you to self-isolate, right? Our argument is that is a form of treatment, because it's a way of trying to figure out if you in fact have COVID-19. You don't know the answer to that question. It could be that you don't have it, but if you can't get tested, this self-isolation may be the only form of treatment available to you.
Right,
Is that basically what we're saying?
And again, yes, because we know from the CDC what symptoms are. And, with individuals who are showing symptoms, or know for a fact that they've been exposed to somebody who has been diagnosed, and there is a potential that they have contracted the virus and have COVID-19. So a lot of this is looking at the opportunity for the employee to self-isolate. They can't engage in daily activities, they cannot work, and this treatment is under the advice of a healthcare provider.
All right, let's look at question number 5. If my healthcare provider orders me to self-isolate because I suffer from an underlying condition that could likely increase the severity of COVID-19, would that qualify me for FMLA leave? Now, we already know from the Department of Labor, they've already said that, just because, you want to avoid getting exposed, you can't just say, well, I'm going to stay home until this thing is over, and I'm going to count that as FMLA leave. Department of Labor says, no, that's not going to be FMLA leave. This question speaks to, well, what if I have an underlying condition? Because what we know about COVID-19 is, for people with certain underlying conditions, it is much, much more deadly. The odds of hospitalization and even death are significantly higher for people with underlying conditions. So this question gets at, well, if I'm one of those people, and my doctor's telling me you need to self-isolate because this is very dangerous for you, could I make a good argument that I should be allowed FMLA leave for that?
And we looked at this in understanding the high risk nature. I think the answer is it could. The argument is there. And really, we have to think about the situations first where an employee has already been qualified for FMLA because of this underlying condition. And they've been taking FMLA previously episodically or intermittently. This would now turn that intermittent leave into a continuous leave, as recommended and certified from the healthcare provider. So, when we have chronic, we think of it as causes episodes or flare-ups, which could be partial days or days, certain number of days per week. We think the employee has certain amount of time, frequency for episodes that will last a certain amount of time or duration. So if we apply that and the employee has already been certified for FMLA for the underlying condition, I think the answer is much easier. And it just requires the healthcare provider to turn it from an intermittent leave into a continuous leave. I think it's a little bit harder when we think of individuals who haven't already been covered by FMLA. They've worked through their condition. They've not really had episodes serious enough to prevent them from working, but the condition is there, and they therefore get this advice from the healthcare provider because of their underlying condition. It may be a long-term condition that they're really not getting active treatment for, but the doctor is just supervising their treatment. So in those situations, it's going to be based upon the doctor's certification, again, that addresses the permanency or the lifelong condition that is triggered by the high risk exposure to coronavirus. The CDC gave us a list. It's not all inclusive, I think. Individuals with lung, diabetes, asthma, heart conditions, or other type of treatment that may have compromised their immune system.
So in essence, we may have some people who have an underlying condition. It's not chronic in the sense that we look at other chronic conditions, and maybe it doesn't flare up. It doesn't cause them to be incapacitated. And now, but it's nonetheless an underlying condition as far as the dangers posed by COVID-19. So we're saying, well, let's look to this other provision of FMLA that speaks to permanent or long-term conditions for which there is no effect.
Right, and again, I think that also not only, it's not going to only apply to the employee, but we always have to think of the situations when we need to care for family members who are high risk as well.
All right, let's look at, finally, question number 6. My employer recently learned that I have been exposed to someone diagnosed with COVID-19. Can they order me to not report to work for 14 days? If they do so, should I request this leave be charged to my FMLA leave? So this question actually came up since we did the last webinar. We actually had a situation similar to this where an employer told an employee, I know you've been exposed. You need to I'm putting you out of the plant. You're not coming in for the next 2 weeks. And the issue became, well, is there going to be, could they use FMLA leave for that? So what do you think, Joan?
Well, we go back to the diagnosis and exposure questions, and the DOL guidance has told us that the employer should have a plan of action of how to deal with employees who have been exposed so that they don't carry it into the workplace and jeopardize the employer's business to continue, the ability to continue to operate. So we think about the exclusion of individuals or barring individuals from the workplace. It has to be done in a way that is not discriminatory and based on objective evidence. Discriminatory, as we look at that definition, again, from the Department of Labor, talks about individuals who are barred if it's discriminatory based upon race, national origin, disability, those type of situations, what we call protected classes of individuals based upon federal anti-discrimination laws. So we think the answer is yes, as long as it's not discriminatory. Objective evidence, again, following the CDC, understanding what is objective to the extent of symptoms, as well as, sometimes it's a matter of knowing that somebody you've been in contact with has been exposed, and it's a better practice and plan of the employer to exclude those individuals. So the FMLA is not going to give you pay, but it will protect your job and your health insurance. We can't forget that this might also be a situation where the employer can apply short-term disability. And locals can negotiate plans of action and policy that if employees are directed to leave work and not return, that will be paid under an employer's policy or recently negotiated agreement.
Right. I mean, I think that's really key too, right? Because if an employer is telling somebody not to report to work, that has to be part of a plan, right? It can't be just something like, I came up with that today. It's got to be part of a plan of action. That's the term DOL uses, plan of action. That plan of action, is most likely going to be, well, we know it's a mandatory subject of bargaining. So I think, folks need to make sure the union's aware that this is going on, give the union an opportunity to make a bargaining demand. I mean, our hope is that we could bargain something better than just unpaid FMLA possibly, right? So I think it's very key that the union be notified and brought into this very early on. Because again, this is going to be something that impacts lots of people, not just this one individual.
And also, if the employer is using objective evidence and sending an employee home, the best way to address the employer's, I guess, impression of the evidence is to get tested. And unfortunately, that's not available to a lot of folks. It's not available in a lot of areas. Tests can, even though you may get tested, it may take days before there are results of the test.
Right.
But again, in addition to involving the union, knowing what your employer's policy is and plan of action, getting a test to confirm the employer's concerns, as well as getting, whether the test is positive, and if it's negative, then I think that's your best ticket back into the plant.
Okay, so this was our webinar on trying to look for ways to make FMLA accessible to people during this pandemic. As Joan had said, we know there are a lot of shortcomings with the Family First Coronavirus Response Act. FMLA covers way more people than that does, and certainly way more of our members. So I hope people got some good information out of this. I want to point out to folks that my background for this webinar is the logo from our Rapid Response Program. Here's another thing that's going on in the union that people should be aware of. We are working on, all across the country, we are working and lobbying state legislatures to pass leave language that would actually build and improve on what's currently available to people under the federal law. So please stay tuned. Please follow what's going on with rapid response. This is, the facts with this crisis are changing all the time. We're trying to get out good, relevant information to people as best we can. And I'm going to leave the final word to Joan Hill, who's such a great resource for our union when it comes to these kinds of leagues. So Joan.
Yeah, thanks, Guillermo. And I just want to say to our staff and our members, this is an ongoing process, and we continue to gather information and share information with you as necessary. We've had the full backing of our president's department, our legal department, as well as our technical support here within our department. And I want to shout out to those that have been helping Guillermo and I with putting this information together. Remember, the union is your first line of defense. And in any of these situations, and even broader issues that come up related to COVID-19, we have a lot of resources through our webpage, usw.org. And hopefully these types of webinars, as we continue to put these out, will help answer questions and give you some relief and some comfort to know that, somebody's got your back. Thank you.